What is the worst case of, I know better than my doctor, you've ever heard of? Young, bubbly mother I know was diagnosed with breast cancer. Tried alternative meds as promoted by her flaky girlfriends. Eventually, she returned to the doctor who told her it was too advanced to do anything. She died, leaving a little boy for her husband and extended family to care for. I still believe her friends contributed to her premature death. Story 2. My mom got Lyme disease and saw a so-called specialist who convinced her the infection was now chronic, and she took antibiotics for like 3 years. After the first year, her symptoms changed, and she asked the doctor what was going on, and he said, "Oh, I guess you must have a co-infection," then put her on more antibiotics. After 4 years of this, she was hospitalized for pulmonary embolism, and it turned out she actually had stage 4 lung cancer. She died 9 months later. Oh, also the doctor convinced her that the entire family also got Lyme disease, and I took the stupid pills for almost 6 months before I realized it was a pile of crap. Screw that guy. I'm still angry my dad refused to sue him for malpractice. Edit. All of these responses made me investigate him a little. Turns out, Doctor has gotten into multiple legal battles over the fact that he diagnosed Lyme disease based on different criteria than the CDC and gave treatments, such as hyperbaric oxygen chamber treatments and long-term intravenous antibiotics, that are not approved for treatment of Lyme disease. So, yeah, I think I'm gonna have to talk to my dad about this again, because this guy needs to be stopped. Is this guy out here actually thinking he's saving people? Because surely he's seen no proof of that with how he's going about it. Lyme disease is some scary stuff and absolutely needs some proper treatment. This guy is doing like 10 times the amount of harm compared to the good he's doing. Story 3. When I was in 7th grade, I hurt my pinky finger playing softball, but my dad, being the assistant coach that he is, told me I just jammed it. I told him, I think I did more than that, since my finger was completely numb, yet in excruciating pain. Like, I picked up the softball after it happened and it felt like there was a hole in the ball where my finger was supposed to be. Disregarding everything, I was sobbing to him. He decided to pull my finger since it was jammed. For the next couple of months, I continued to play softball, thank God for Icy Hot and Advil, where my dad said maybe it wasn't jammed since it still hurts. You probably just have a bone bruise. Eventually, my finger also developed a very solid bump on the side of my joint, still there by the way, and the pain never really went away. When softball season ended, we finally went to the doctor and had x-rays. When the doctor saw them, he was amazed I still played, since my bone was completely shattered into at least 6 pieces. He said he couldn't give me an exact number because of the healing and the angle of the x-rays. The bump on my finger was a calcium buildup from the healing, which could have been avoided if I had gone to the doctors when it happened. The only good thing was that I didn't need to have my finger rebroken to fix the placement of any of the fragments, since my dad pulled it initially. Gotta love coach dads. Story 4. That recent couple who had a malnourished 7-year-old who decided that their kid was gluten intolerant, and so never gave him anything besides crap like quinoa milk. They owned a health food store and were also health nuts. Anyone who came in and saw the sickly child commented, but they brushed it off and didn't seek help. Drove to a homeopathic doctor across the country who sent them to a hospital, but they apparently decided to drive back home first. Yeah, the baby died before they got to the hospital. Autopsy revealed the child was severely dehydrated, and the stomach had been empty for days. Weighed about 9 pounds at time of death, which is just slightly higher than a newborn. They knew so much more than a doctor that they decided not to go to one. Edit. Since a lot of us are rightly sickened by the story, here's the outcome. The judge gave them a 6-month suspended sentence after determining that they didn't willfully neglect their child, and you can't charge them for murder just because they're stupid. I beg to differ. The parents say they tried unsuccessfully to feed their child, but it fussed with the bottle and breast milk, so they concluded their baby must be lactose intolerant and also gluten intolerant. Instead of getting actual doctors involved, they felt confident enough in their self-diagnosis that their baby had an eating disorder to continue giving the baby quinoa milk and the like. They didn't notice anything wrong with their baby after that except, the child casually having severe trouble breathing. After visiting the homeopathic doctor, they didn't make it fast enough to a real hospital. They live in Belgium, which isn't exactly huge, but I'm trying, unsuccessfully, to leave my opinion out of it. Interesting to note, a prayer card was tucked into his diaper. Prayer and quinoa, folks. That's all you need. If your baby was fine, why do you need a prayer card? Oh, I'm so mad. Story 5. My mother believes that if you make food from scratch, then it's healthier for you. For instance, she thinks that making a chocolate cake from scratch, including milling her own flour, is a healthier alternative to a store-bought cake with identical ingredients. She is diabetic. Her doctors have said in many ways as they can think that she has to reduce her carb intake. And what my mother thinks is Gosh, maybe I should grow the sugar cane myself instead of buying sugar at the store, and my blood work will finally be in the normal range. Her liver and pancreas have failed multiple times. Each time, the doctors managed to restore organ function by restricting her carb intake. They explain she has to continue following a low-carb diet at home. She does not, because she's convinced that she's already on a healthy diet. Rinse and repeat. Story 6. Diabetic patients have the worst cases of I know better than you, and their denial phase lasts forever. Currently, I have a 65-year-old woman, disabled, morbidly obese, can't walk, has diabetes along with multiple heart and kidney issues. She is notorious for her non-compliance. Last visit, I was trying to convince her to take her morning meds and get all these imaging studies done, and she refused because she didn't feel like it. During the convo, she asks the nurse for some milk. The nurse says your sugar was 450. I can't give you any milk. She freaks out and starts wheeling herself out. She's notorious for wheeling across the street to get some Dr. Pepper around the clock. So I yell out, "Hey, you gotta stop drinking Dr. Pepper." Her response? "My sugar is high regardless of what I eat." Guaranteed she will die from diabetic complications within the next 3 years. Well, you can't help someone who won't help themselves first, I guess. But I can't imagine being that person's doctor. Oh, that's frustrating. Diabetes is a pretty, well-documented thing. Like, we mostly know how to keep it under control nowadays. Why would you take all of that and just choose to ignore it? Just because your body is yours doesn't actually mean you know it that well. Story 7. I teach people on a daily basis how to use urinary catheters. You aren't supposed to reuse them, just use it once, throw it away. And when you need to catheterize again, open a new one. That's because using a non-sterile catheter can cause urinary tract infections and a host of all kinds of other problems. The doctor will send us a script on how many per day the patients need to use. And every single day without fail, I'll have one or two tell me that their doctor is wrong, and that they only need 1 per day, because they'll just wash it off and reuse it. No, it says on the packaging not to do that. Your doctor said not to do that as well. I'm telling you not to do that. Why do you still think it's okay to do that? Story 8. About 15 years ago, before the whole gluten-free trend, I worked with a guy who was a vegetarian. We worked side by side, just the two of us, and got along really well. One day I got curious and asked what led to his vegetarianism. He told me he'd been having some health problems and went to see the doctor. Doc ran some tests and told my friend he should cut wheat out of his diet. This guy says, "Well, that doesn't sound right. He must have meant meat instead of wheat." You could probably hear how stunned I was on that one. That was a twist I wasn't expecting. Why would you not, just double check with your doctor, confirm, maybe ask some questions? I don't know. Anything? I don't know if this is I know better than my doctor, more than just like, I don't even know what to call it. I have no clue. Story 9. Friend of mine sees way too many of these cases on a daily basis, but the worst so far has to be this lady whose child was born prematurely, so her baby was rather small to begin with. The doctors do their usual thing, give her advice on childcare and everything. She comes in a week later saying her kid was sick, not sure why. Friend was appalled to find out that her baby had barely put on any weight since birth, and immediately asked her what in the world she'd been feeding the kid. Woman says, "Oh, I figured since he was so tiny he didn't need to eat that much, so I've been sticking to about an ounce of milk per meal." Seriously, woman. I don't know how the child's doing now, but I can only hope he's well. Story 10. Working at a supplement store years ago, I had a woman come in asking about vitamin B17. She said her doctor had cancer and was taking her off chemo despite her doctors pleading with her not to. Some friend of hers claimed B17 was a miracle vitamin they don't want you to know about and can cure just about everything. I told her she should listen to her doctors, and she told me to screw off. Story 11. I was sick almost 10 years ago. I didn't quite know what it was, but it was a weird pain in my stomach that kept getting worse, and I had zero appetite for several days on end. I go to the hospital and nobody seems to believe me that something is very wrong. The triage nurse has me wait until I'm the very last person there. When my name is called, I can barely walk to the back. The doctor spends less than 5 minutes with me and gives me some anesthetic to drink. The pain subsided and I started to walk out. Suddenly, I start heaving and puke a significant amount of blood on the floor in front of the doctor. He tells me that it isn't something to worry about and makes me leave. I knew that was a BS excuse to get me out of there. The next day, I went to a different hospital and immediately got into a room. I went through x-rays and various other tests. Turns out I had multiple ulcers in my stomach that were pushing against some other organs. I was immediately attended to and the problem went away entirely within a few weeks. I have health insurance, my family is quite wealthy too, and I live in Canada. I ended up contacting Health Canada and had the doctor fired. I debated civil action, but opted not to. Story 12. Here's your daily kick to the rubber parts. My father was a stubborn bastard, and was adamant about not following doctor's orders. Longtime smoker, drinker, etc. So dear old father goes in and has a mole excised from his dong. Uh-oh. Biopsy comes back and it's not malignant. Great. Problem? He didn't follow the doctor's orders on how to take care of it after the fact. Gangrene. Yep, they lopped it off. I only found out about that in my late teens. It was a mind-shattering reveal from my mother and older sister. Story 13. I had severe swimmer's ear in 7th and 8th grade, and it got so bad to the point where I was crying constantly. I went to the doctor where she gave me this horrible medicine. A week later, the pain has gotten worse and I can't hear out of the ear. I kept telling my mom that it wasn't working and she ignored me until I finally stopped hearing out of it. I see a different doctor and he was like, "What the hell did that other doctor do?" He got me on the strongest ear drops he could find and said one more day of waiting and they might have had to put a wick in my ear. He also told me that the medicine the other doctor gave me was for something completely different in the ear. The infection went away, but I still have slight hearing problems in that ear to this day. Go to hell for all the pain and 7 days of sleepless nights you put me through, other doctor. Story 14. Probably me. I've talked about this before, but I'll share again as sort of a PSA. I was addicted to a drug called Mercendol, which contains a relaxant plus codeine plus paracetamol. It started at 2 tablets a day, then 4, then 8, and after a couple of years, I was taking 40 plus a day. I thought all the warnings about don't take more than 8 a day were stupid. I was all, I take 40 a day, so I'm fine. I went to the hospital for an unrelated issue with my eye, and they freaked out about how much paracetamol was in my system. I lied and said I took heaps due to the pain in my eye, and they tested my liver and said it was inexplicably fine. From there, I realized just how close I was coming to death daily. I'd built up a major tolerance, but generally, 40 plus paracetamol is enough to end 2 people. It's insanely lethal. It took me another year to give it up and have researched it a lot now. People think Panadol/Tylenol is harmless. It's not. People take heaps. They wake up fine and think they're safe. In reality, overdose symptoms don't appear until you're literally dying, and at that point, there's nothing they can do to save you. You have a 24-hour window to have your life saved. Even if you build up a tolerance, it doesn't mean you're safe. I am the exception to the rule. Story 15. Here's a kind of backward situation. About 6 years ago, I scratched my face really badly and it got infected. I was put on a sulfa medication for 14 days and that was that. Day 1 felt weird. Mother asked the doctors in my family and they all said it was normal. Day 2, extremely uncomfortable and same response. Day 3 ended up going on a flight. When I got off, I was throwing up tons. Doctor said it was because of the flight. Day 4, no longer wanted to eat anything. My stomach hurt too bad. Period started without warning. Day 5, constant pain, period heavier than ever. Doctor told me it was just a heavy flow. Day 6, I'm begging my mother to let me stop the medication and to let me go to the actual doctor. She calls the doctor and the family again and they conclude I'm just being dramatic. Day 7, refusing to get up. Have gone through a box of tampons in 4 days, downing Advil and other over-the-counter painkillers like it's candy, as well as chugging NyQuil to help me fall asleep. Day 8, slept the entire day away in a drug-induced slumber, was told I'm just being lazy. Day 9, doctors told my mom to take away the Advil and NyQuil. She did. Spent the rest of the day just sitting naked in the bathtub because I was bleeding through pants and tampons like crazy. Mom and doctors still think I'm exaggerating. I never let my mom into the bathroom. Was just trying to brush it off as a bathroom issue. Day 10. I throw up blood, a lot of blood. Mother finally agrees to take me to the hospital. I'm immediately rushed in and given a blood transfusion and have my stomach pumped to remove any traces of the sulfa drug I had a severe allergic reaction to. This caused my blood to stop clotting, hence the period. A normal platelet number is 150 to 450,000. Mine was down to 10,000. I was on the verge of bleeding out, and any injury could have caused serious damage. Now my mom doesn't understand why I never listen to doctors in the family. I don't care if they know what they're doing. Obviously, they can't understand over the phone. Also, listen to your kids, damn it. If they say something is seriously wrong, don't immediately assume they're faking to get out of something. Edit. Just gonna mention that my mom wasn't trying to neglect me or anything. I would cry wolf about being sick a lot back then because of my depression. I was also supposed to go to a family event, hence why I was on the plane, and I was notorious for getting sick when I had to do stuff like that. The doctor in the family was also my grandma, so my mom trusts her a lot. Aunt chimed in, but it was mostly my grandma. Super edit. My mom is not a bad parent. She's made mistakes, sure, but the amount of people calling her neglectful and a horrible person is sickening to me. This woman stayed up night after night looking after me when I wanted to end my own life and does everything in her power for me. I love her so incredibly much. And even if she made a mistake in the past, I don't blame her. Like I said, I was constantly crying wolf about illnesses for years. Even now, she still goes out of her way to care for my useless butt, and if it wasn't for her help, I would have taken my own life years ago. It's hard to understand the situation if you weren't there, and trying to make you guys understand would take hours, since clearly you're hell-bent on labeling my mother a demon. Call me anything you want, but don't judge my mother over a mistake. As soon as the sulfa was clear of my system, I was fine, though I felt weak for a while afterwards and had to stay home to avoid injury just in case. I've said this before, but allergic reactions to drugs are horrifying, because there are very few ways to know until it happens. And sometimes when it's happening, like here, it's hard to tell that it's happening. It could be a host of other things. I do think it was unwise to not take OP to a hospital earlier. Something was clearly wrong, but OP seems very set on defending their mother here, so fair enough. We don't know the whole situation, it's true. And hey, OP made it out on the other end, so it didn't go completely disastrous at the very least. Story 16. My brother-in-law has chronic back pain and regularly goes to a chiropractor for it, and apparently said chiropractor also works on my brother-in-law's neck. After one chiropractor appointment, my brother-in-law experienced severe weakness, to the point where he could hardly get out of bed. At one point, apparently he collapsed and had slurred speech. I, an RN, was like, dude, get thee to a hospital, because that sounds like a stroke. At the time of this conversation, I was also hanging out with another nurse who used to work in neurology, and she agreed he should see a doctor ASAP. He was like, nah, my chiropractor's a doctor and knew about it and said it would go away. He's very much an alt health kind of guy and thinks stuff like vitamins and coconut oil will cure anything. I also remember looking after this one guy who came in post-myocardial infarction from the cath lab. His blood pressure was sky high. Patient denied any major health issues in the past, and he only took supplements. I called the doctor about his BP and the doctor ordered some antihypertensive pills. Before the patient took them, he ranted about big pharma and how drugs don't work, and that if he were just allowed to go home and take his usual herbs or whatever, he would be fine. Judging by the fact that his BP refused to come down after the pills and required an IV nitroglycerin infusion, as well as his ECG showing signs of left ventricular hypertrophy, typically caused by high blood pressure over time, and the fact that he had a massive heart attack showed me that his heart problems had been brewing for a while, and as expected, his herbal supplements were doing squat. Story 17. My granny. She is the most maddeningly religious person I know, but I love her to bits. She was recently hospitalized because she felt exhausted for a few days. Given that she's 75 and obese as all hell, it was worth the hospital stay. The doctors told her, "So you can't be released. Your blood pressure is so high that you could literally have a stroke right now. Also, have you been treating your diabetes?" She said,
"No, because I don't have diabetes, and I'm taking natural medicine for my blood pressure."
I was in the room and basically went, wait, back up. You have diabetes and you knew about it and chose not to say anything? And you're taking witch doctor BS for blood pressure? She basically gave me this look that read,
"Yes, I am, and I don't care what you think."
I promptly got every goddamn member of my family packed in this hospital room to guilt her into taking actual medicine. Honestly, I think she lies to us when she says she's taking it. I've been mentally preparing myself for her death for a while now. Story 18. While talking with my OB and asking a ton of questions about my pregnancy, he told me a story. He was the on-call doc for hospital, and goes in after shift change from another on-call doc. Woman has been actively pushing for 3 hours. She has refused a C-section multiple times over because she is certain she can have the baby naturally. Turns out the baby was stuck, and the pushing caused major brain damage to it. My doc tried to persuade her, but she continued to refuse. Ended up having to do a C-section to retrieve the body. Women often have this overwhelming expectation of how their labor and birth are going to go, avoiding C-section and meds like the plague. The reality is, those things have saved many lives. Story 19. Trying to plan a birth is like trying to plan a train wreck. I thought I was going to have a natural birth. No pain meds, everyone healthy, birds singing as I cheerfully nursed my baby. Yeah, no. After 4 days of contractions 5 minutes apart, so 4 days of no goddamn sleep, I went to the hospital. I got pitocin, then an epidural because I was exhausted and had no mental toughness left. then a crash C-section, probably because of arrest of dilation. After 10 or so hours in the hospital, I was still only at 4 centimeters. Edit. I say probably because of arrest of dilation because this DX came from a doctor who's an OBGYN intern now, but was not at the time the kid was born. We were just shooting the crap about it the other day and he said, "Wait a minute, how far did you dilate?" Story 20. A friend of mine had stage 4 cancer. She went through chemo for over a year and they told her that they would let her take a break. Well, when they looked at the cancer, it hadn't shrunk as much as they would have liked. So they told her she couldn't take a break. She started posting on Facebook about these organic green juice cleansers that someone had messaged her about. I was at her bedside, begging her to keep doing the chemo. I told her she could do the juice cleanses if she thought they would help, but don't stop the chemo. She responded, "But they won't work if I don't stop the chemo. That's poison in your body. I know my body, and it's going to heal it." She wound up entering hospice on her 30th birthday and subsequently passing about a month later. I'd love to find whoever peddled that BS to her and punch them right in their frickin' mouth. Story 21. Not my doctor, but my mom's. My mother had a heart attack February of 2017. She was prescribed a couple medications, such as beta blockers, etc. My aunt, who's against vaccinations, prescribed meds, and anything non-organic, tried to not only tell my mom the medications she was prescribed were the wrong ones per a quick 10-minute Wikipedia search, but also that my mom's heart attack must have 100% been health-related, despite multiple tests and the doctor telling her it was simply stress-induced. I'd also like to add that we called my aunt immediately after the ambulance arrived to take my mom to the hospital, and she said she wasn't going to make the 40-minute trip to the hospital unless it was serious. She has also done the same "I know better than everyone" bit in other health-related situations, and she's the type of person you cannot disagree with because the conversation will just go nowhere. Very aggravating, to say the least. Story 22. Here's one where my mom was right. I was in 5th grade and was constantly vomiting and the right side of my chest was always hurting. Also had a high fever. My mom took me to our doctor and he told her I had a bug and to just make me rest and drink lots of water. I have a low pain tolerance, so everyone assumed I was just exaggerating how badly I was hurting. After sleeping as much as possible and drinking so much water I was practically peeing clear, I was still vomiting a lot and my fever was consistent. Also still had chest pains. My mom called the same doctor and he gave the same advice. Rest and drink water. Mom says my lips started turning blue the next day and she took me to the ER. My right lung had completely collapsed. I was in the hospital for 10 days with pleurisy. I'm glad my mom finally stopped listening to that doctor and I didn't die. To be fair, the odds of my lung having collapsed at 11 years old were slim to none. The doctor was just doing his job, I think, until a few years later when he tried to take my dad off his thyroid medication and told my dad to buy herbal supplements from the doctor's wife. My mom reported him to the medical board and we switched to doctors at that point. Story 23. Every person who has opted to treat a diagnosed condition with naturopathic medicine. I've diagnosed patients with cancer who have shunned modern-day treatments, only to turn up months later with horrible stage 4 disease, asking for miracles. I'm all for taking herbal supplements to prevent disease, but when you're finally diagnosed with a condition, stroke, heart attack, whatever, you need the prescription stuff. In the NW, I frequently admit patients who seek emergent medical care for a condition only at discharge for them to say, "Yeah, I'm gonna go see a naturopathic doctor." Ugh. Frankly, I'm bewildered it's not considered unethical or illegal to advertise statistically/scientifically unproven therapies to people. Had a guy who kept coming in 3 times with a heart attack. We would save him only for him to sign out of the hospital saying, "God will cure me." Why bother coming in then? I had to finally call his pastor to convince him to stay and get all the right treatment. Story 24. Okay, so I interned at the district attorney's office, prosecutor, this past year. Sovereign citizens are always a great delight, because they don't cite law and basically just make up nonsense. Some even submit briefs as counter plaintiff. Even if you don't know law, you know this is wrong. The guy was pulled over for a minor violation. I think his brake light was out or something, but he reeked of marijuana, so they arrested him. He was smart enough to not completely abandon the public defender being there to help him, but midway through a question, he literally said he knew more law than everyone in the room. And yes, the judge was on the bench. Well, Opie, not quite the question, but it's the same sort of vibe, so I'll let it slide for now. And by let it slide, I mean I read it instead of skipping it. You're welcome. Story 25. Me. Starting at age 18, I had severe stomach pain every now and then, particularly after I ate a big meal. The pain would double me over. I didn't want to be touched. Every time I'd go to the doctor, I'd be told it was gas pain or menstrual cramps. For 5 years, this carried on. I was researching my symptoms and had a pretty good idea what was going on, but when I told them my suspicions, I was brushed off. I was only 21, too young for what I was suggesting, apparently. Finally, I was told I was seeking pain meds, and I wouldn't be seen anymore for my stomach pain. I've never taken pain meds for anything, due to opioid addiction being a huge part of my family history. I didn't even want to take the chance. 1 month later, I had a fever, I was throwing up, the pain was horrible. I called my doctor and he refused to see me, but recommended a good psychiatrist to talk to. After that phone call, I laid down and my fever rose. I was rushed to the ER, and if you haven't guessed my problem yet, well, I'm about to tell you. I had gallstones, and had for a while, and my ER trip revealed that my gallbladder was infected due to a stone being lodged in the duct. I needed surgery and I needed it ASAP. I lodged complaints against the doctor that refused to treat me, explaining that he didn't take my concerns seriously. He eventually moved his practice to another state, and I hope he became a better doctor. Story 26. Not that long ago, I heard about some lady whose doctor kept telling her that she was just overweight and needed to lose weight. Turns out she had cancer that had spread to both thighs and had been allowed to get huge because her doctor wouldn't test for anything other than just being overweight. So it kinda goes both ways, folks. Sometimes the doctor can make a stupid assumption that costs the patient her life when it could have been treated if caught early. Story 27. It's nothing specific, although I'm sure a quick Google search would yield plenty of results. But obesity is a serious problem in the US, but plenty of people think their doctors are mean if they call them overweight and obese. While fitness comes in many different shapes and sizes, oftentimes if your doctor says you need to lose weight or your life expectancy will be a lot lower, you need to lose weight. All too often, people will simply say that they're beautiful just the way they are and won't make an attempt to maintain a healthy diet, and that just puts them in the grave that much sooner. You're beautiful, yes, but if your weight is unhealthy, lose some. You'll be helping yourself. This is an interesting combo with the last one, because they're kind of the opposite of each other, and both are true from what I know, because I'm well aware of lots of cases where people have been told they're overweight and that's the source of all their problems, when really there's an underlying thing that could also be treated. But in the same vein, there are situations where the doctor's like, hey, you should probably lose some weight. They don't, and then develop issues because of it. Personally, I am a big proponent of body positivity. That being said, I'm also a big proponent of medical sciences, and what those say is people who are morbidly obese run into more health complications than those who are not, and that the two have a direct link as opposed to just some sort of correlation by chance. Loving yourself is important and great, but I think that with loving yourself comes treating yourself in a way that is healthy and good as well. Hopefully I don't start a war in the comments or something, but I did want to talk about it a bit considering this story and the last one. Anyway, moving on now. Story 28. My friend was a bodybuilder, suffered a heart attack at a young age due to the screwed up status quo of the sport, and was ordered not to work out. He responded by finding a gym out of town and working out there. He had another heart attack while at that gym and never regained consciousness. I don't think he was arrogant, just addicted. But he left a very, very sad wife behind, in addition to a huge group of friends, because he was as sweet as a big, swole meathead could possibly be. And he was a little kid, in need of a place to hide out from his insane home life when we met him. So he was our little baby, even though he ended up having 100 pounds more muscle than the rest of us. I don't know why I'm writing this, but I loved him, and writing feels so much better than not writing about it. Just please take care of yourselves, and don't let anything so preventable happen to you. Story 29. My wife was experiencing contractions and ready to give birth, but the amniotic fluid was leaking inside of her and she wasn't dilating. The nurse says she needs a C-section immediately. I also said I'm pretty sure she needs a C-section, and my wife says she definitely needs a C-section. But the doctor insists on jamming his fingers into my wife to somehow force her to dilate. Yeah, it makes things worse. Much worse. Fast forward to my son in the NICU for a month and my class action lawsuit being filed. Story 30. So I know this is a bit backwards, but here goes. Back in the second semester of my first year of university, I started to notice something was off. I was having bad stomach aches. My hair and skin were super dry. I randomly gained 10 to 15 pounds, which at 5'2" was quite noticeable, and I was exhausted all the time. Literally, I could get 10 plus hours of sleep and wake up out of my mind tired. Finally, when it got to the point that my friend in calculus had to wake me up from nodding off literally 6 times over the course of one 50-minute lecture, I decided I'd had enough. I got him to help drag me over to our campus clinic and got on the list to see a doctor. A couple hours later, I'm in an office and explain everything to the nurse and then again to the doctor. He asks me a few basic questions about my lifestyle, when my last period was, etc. Says, we'll do a blood test and see you in a couple of days. Blood test happens. He tells me it comes back normal, but he wanted to do it again. So I go back to the clinic to get poked. Yet again, the results come back normal. Lather, rinse, and repeat for a third time. Now, through all of this, I'm still experiencing the same symptoms, and am in no way, shape, or form the functioning human being I previously was. It had been a month and a half, and I was tired of being poked and told everything was fine. What does this guy want to do, of course? Well, run a fourth blood test. I lost it. I asked him, do you think it will show anything different? He goes, if it's what I think it is, it might. I reply, look, I'm done with mites. I'd like to know what the next step is in regard to diagnostic options. His solution? An abdominal ultrasound. Okay, at least it's moving somewhere away from what has gotten us nowhere, but I was curious. What was he looking for / did he expect it to show? Turns out the jerk had decided that as a first-year, newly legal and single female living on her own, the only solution was that I had gone crazy with my promiscuous ways and must be pregnant, despite the fact I was on birth control and had 3 blood tests done with the negative results. He was convinced it was just early enough that the hormone level hadn't built up enough to be detected in my blood. Luckily, I live in the land of the Great White North. Yay, universal healthcare, but still. I ended up getting the ultrasound anyway, partially to prove him wrong and partially just in case anything else showed up that this idiot would have otherwise not tested for, and sure enough, guess who wasn't pregnant? Everything else looked normal too, so I gave up and didn't go back. A week or 2 later, I had a 4-day weekend and flew back to my home province. My mom took one look at me and drove me straight to my childhood family doctor's office. By the time I was ready to fly back for school 4 days later, I'd been diagnosed with an autoimmune disease that had become severe due to being unchecked. Then I got a treatment plan in place and finally felt, for the first time in months, like I wasn't crazy. How did they diagnose this, you ask? Well, it was simple. A blood test. Turns out it's amazing the amount of information you get back when you aren't only checking the box for pregnancy tests to be run. Story 31. I'm a CMA and work in an endocrinology office. At least 50% of my patients are extremely non-compliant and have the I know better than you attitude, especially my diabetics, both type 1s and 2s. Just last week, though, I had a patient demand a prescription for thyroid medication, even though all her labs came back perfect, but she felt terrible. I also regularly have patients who are taking a billion supplements and vitamins and even sugar pills from MLMs. This cinnamon supplement controls my diabetes. Okay, Craig, but your A1C is 14 plus. Oh, and last week I had a patient whose blood pressure was 224 over 108 after taking it multiple times. Electronic and manual, different arms, etc. Both the doctor and I took it multiple times. It wasn't a fluke. This guy needed to go to the ER ASAP, but he refused because, you women don't know what the hell you're talking about. Doc and I are both women, and these are all very common occurrences. Story 32. I spent 10 years dealing with extreme pelvic pain and heavy bleeding. It started out as bad periods, and ended up getting to the point where I was bedridden with pain from the waist down and couldn't do anything myself. My boyfriend had to help me take showers and get dressed. I'd soak through a Super Plus tampon and overnight pad in an hour or less. I kept having ovarian cyst ruptures. I had chronic back pain. Me and my boyfriend couldn't do anything because it just felt like I was getting stabbed. I kept gaining more and more symptoms and eventually wanted to take my own life. I was taking oxycodone, hydrocodone, and 800 milligrams of ibuprofen every 6 hours and was still in pain. I went to over a dozen doctors and they all told me I just had bad periods or needed to lose weight. Some straight up told me I was exaggerating the pain to get attention or drugs. It was routine for me to go to the ER for IV painkillers during bad episodes because the pain would leave me screaming in bed. I started doing research and joining online support groups and narrowed it down between a few diseases, and would bring them up at my appointments to see if there was a way for me to screen for them. My doctors would ignore it, test me for diabetes and thyroid issues instead, even though I didn't have problems with either. I finally found a doctor who diagnosed me with PCOS and endometriosis, and performed a surgery to remove the endometrial adhesions and a very large ovarian cyst. He also suggested I try Nexplanon. It's now been 1 year and 3 months since my surgery and 1 year and 2 months since getting the Nexplanon, and my symptoms are drastically reduced. I don't get periods, I haven't had a cyst rupture since my surgery, I'm able to live a normal life and might become an assistant manager at my job. I rarely have pain days, and if I do, it's nothing compared to what I used to have every day. I suffered with progressively horrible symptoms for a decade and was treated like crap by so many doctors, only for one doctor to drastically improve my quality of life in the span of 3 appointments. Sometimes people are wrong and should listen to their doctors, but sometimes doctors are wrong and should listen to their patients. All of the BS I went through could have been avoided if I met a compassionate doctor sooner. Story 33. I once worked with a patient who had total placenta previa, where the placenta sits on top of the cervix. What that means is because when the woman goes into labor, the cervix has to open up and the placenta has to get torn apart for that to happen. There's a lot of bleeding, a crazy large amount. It's really fairly manageable these days, though. You have to make sure they're close to medical assistance, so if they do go into labor, they can get help, and book them for an early C-section to avoid them going into labor at all. This lady, however, wanted none of it. She insisted of staying in the deepest, darkest countryside, 3 hours from the nearest hospital, and she insisted on a natural birth. She said she would come into hospital when labor started. I can understand not wanting to move, but it wouldn't have been all that for her. She just would have had to stay with her parents for a bit to avoid, dying. This was explained to her repeatedly, trying to get her to change her mind, but she wouldn't budge. Then she went into labor at 37 weeks. By some massive stroke of good fortune, she went into labor at the supermarket in town, just after going to an obstetrics appointment, so she happened to be only 10 minutes away. She still bled so heavily that she arrested on arrival at the hospital. She got an emergency C-section while she was out, then a hysterectomy, along with God knows how many liters of fluid and blood, and by the skin of her teeth, managed to survive. You know what her line was on leaving the hospital?
Well, it turned out all right in the end, didn't it?
I don't know why I did that voice, just to be super clear. I think I read the word countryside and my brain just ran with it. Anyway, sorry about that. Moving on. Story 34. Worked as a cashier in a family-owned health food store a few years ago. This one sealed the deal for me. There was a lady who'd been shopping there for years who became a staple there, and became friends with the owner. She had been diagnosed with stage 4 breast cancer a year before I started working there. By the time I got there, she had quite a few rounds of chemo and was desperate to find an alternative therapy that didn't involve hospitals or drugs, etc. One of our employees suggested this thing called black salve, which is this paste that literally third-degree burns cancer out of your face. Google at your own risk. The tumor in her breast was the size of a lemon, and she was told to put a wide section of black salve on so the whole tumor would come out. After about a week or two, we got a phone call saying she was afraid it was burning too much off. Someone was able to talk her down and she kept going at it. A few days later, we get another call from her saying that her breast was hanging by a thread. The next morning, her niece called to tell us that she woke up and found her breast straight chillin' next to her, unattached from her body. She never sued the store because of her not wanting to put out her friends, and kept shopping there. I wanted to throw up every time she came in, and you could visibly see how uneven her chest was. Black salve, not even once. Story 35. This wasn't exactly something I heard, but experienced myself. To give some backstory, a couple of years ago during my junior year of high school, I started experiencing sporadic pain and swelling in my left ankle. Sometimes it wouldn't even be noticeable. Other times I was writhing in agony wanting to cut the whole damn leg off. We decided to go to this little walk-in clinic that had opened recently in our town to see what the problem might be, only to be asked by an awful excuse for a doctor if I was exaggerating to get out of taking my finals that year. This, obviously, not the case, as I was in clear pain and my ankle was visibly swollen. We left the place more agitated than anything else, and looked for other ways to fix it. Not too long after, I decided that enough was enough and I was going to the hospital to get this looked at. Some worrying x-rays and a couple trips to the Vanderbilt Hospital in Nashville later, and we discovered it was actually a Ewing's sarcoma tumor, growing inside of the bones of my ankle. Fortunately and somewhat miraculously, we caught it in its early stages, which almost never happens with that kind of cancer. I survived cancer. If we had taken that doctor's advice at the walk-in clinic, there's a good chance I might be dead or dying right now. And funnily enough, she was no longer employed there by the time my parents were able to raise hell with the place. So I guess her BS finally caught up with her. Story 36. Am a medical student. Had a person come in with completely uncontrolled diabetes and a skin condition. Minor rash that looked like small papules on his arms and legs that he had picked at and scabbed over. With the diabetes, you don't heal well, so some of these were months old. Anyway, the patient decided this was due to allergies. Full allergy panel is negative, by the way, and that the best treatment for it was a warm bath with ammonia and bleach. Asked him if he knew that those two chemicals should not be combined. Apparently the combination was what was treating his rash, which he's had for months now and has been worsening. Couldn't convince him that it was a bad idea / clearly wasn't helping. And of course taking his diabetes meds, that wasn't gonna happen. Oh, this is like advanced levels of doing things wrong. Like you're doing something actively that pretty much everyone knows you're not supposed to do, and then claiming that that is how you solve your medical problems. Yikes. I hope he's figured stuff out for himself by now. I'm not that confident, to be honest, but I hope. Story 37. I work as a security guard at a hospital, and at one point we had one of the busiest ERs in the state. We had one woman come in with something pretty innocuous. I don't remember exactly what, but she was going to get some tests done so she couldn't eat. Well, she got tired of waiting and decided to call the dietary department herself and to order a meal. No idea how she got the number, but she did and got a tray of food. When the nurse told her she couldn't eat that right now, the patient blew up on her, saying she had to because she was hypoglycemic. Well, it turns out she was hyperglycemic, and her blood sugar was sitting at 600. The nursing staff more or less deduced that she had forgotten which she was and was treating herself in the exact wrong way. Story 38. My mom has been chronically sick in and out of doctor's offices for most of my life. She has some pretty bizarre symptoms that, while not common for the problems she has, are in the list. No doctor listened to her when she described those symptoms because, medically speaking, when she had her appointment, she was fine. They diagnosed her with this, that, and the other thing until she finally started Googling and made the doctor test for the stuff she has now been officially diagnosed with. They kind of chuckled, but did it anyway. Oh, turns out she was right. Finally got on good medication and is able to do things she hasn't been able to in years. And when I say do things, I mean she used to be tired all the time, unable to walk well, in constant pain, etc. Most of that is gone now, and we can actually go out for a full day of shopping or whatever instead of coming home after 2 hours because she's on the verge of passing out. Story 39. I had the same thing. I was chronically in pain and the doctors didn't really help. I did some Googling and found that Ehlers-Danlos fit my symptoms perfectly. I went back to the doctor. She Googled it in front of me and checked me for the first symptom on the list, which I didn't have, and not everyone does, and told me, "You do not have Ehlers-Danlos." I could have backed off there and stayed in chronic pain, but I instead went back, convinced them to send me to one of the only 2 specialists in the country as I was sure I had it. The specialist diagnosed me as definitely having it and sent a letter back to my GP confirming it. Oh, it doesn't stop there though. I was back at the doctor trying to get a medication change and she didn't believe that I had it, saying the letter was vague. I then spent £200 going to see the other specialist privately just so the letter wouldn't be vague. The specialist was confused as to why I wanted it confirmed because it was obvious I had it. The GP doctor, by the way, was different each time, so it wasn't just one useless doc, but a whole load of them. I don't trust doctors anymore, but I still go to them because I don't believe in that herbal crap. Story 40. EMT here. I was dispatched to a home for a wellness check. Patient was combative and threatening self-harm. Arrived to find a middle-aged man near death. He was a severe alcoholic, had drank a handle of tequila that day, jaundiced, hard football of a liver, muscles atrophied, vital signs terrible. He's refusing medical care. I believe it was, "Screw doctors, they don't know me." He thinks he's fine. So I get real, tell him the truth. You're actively dying. You're probably not coming back from this. You can die here today or go to the hospital, clean up, and maybe have some kind of life. He quit his BS long enough to consent to treatment and transport. So we get to the hospital and he's alternating between screaming and singing for tequila. I remind him tequila is why he's dying. He reminds me that doctors don't know him, screw doctors, and I remind him that I do know him. I listened, I care, and he needs to get help for his family. He agreed, shook my hand, and I spent the next 10 minutes cleaning up pee and crap off my gurney. I know he's dead, but I'd like to believe he got a few more days, at least. Story 41. Shortly before the second time in my life I dropped out of college, I was having a lot of issues with insomnia and anxiety, so I went to my doctor. For some reason, I ended up taking an ADD test first from a psychologist. It proved inconclusive. I kept insisting for more answers that weren't adult ADD, so we talked about the difference between antidepressants and anxiety meds. She wanted to try some anxiety stuff first. I guess because it's gentler and they're neurologically different. I don't know these things, so I did that. Without going into my sleep history too much, I ended up taking the medication for 3 days before I realized I hadn't slept at all. I thought, this isn't normal, even for me. But the only thing that's changed in the last 3 days is... So I immediately ceased touching the drug. I don't remember its name, and I hoped for the best. I didn't sleep a wink, a moment, or at all for what would end up being 213 consecutive hours before I finally slept for 4 hours midday over a week later. I never went back to my doctor after that. Incidentally, about a month later, I had a eureka moment with a counselor, decided to drop out of college a second time, and move 1,400 miles away, and I've slept every night since. Literally over 2 decades of insomnia disappeared overnight. Lessons. Anxiety is powerful and crippling. Medications can fix you or mess you up. Losing sleep that long will mess you up. Story 42. On the Thursday night before my senior season's opening football game, I had a weird collision that left my entire right arm numb. Immediately, I knew something major was wrong because I couldn't move it and felt absolutely no pain. Adrenaline is a hell of a drug. Went to the doctors the next day for x-rays and such. He told me there was absolutely nothing wrong with my shoulder and refused to take any other tests like an MRI or a CT scan. Unfortunately, my only other option was to visit a doctor who didn't accept my insurance, so I lived on. I dislocated my shoulder an average of 1 time per day for the next year or so. Eventually, I could not accept that nothing was wrong, so I got a couple more scans. Turns out that not only was my humeral head shattered into 7 pieces, but I also tore just about every connecting ligament in the shoulder. After some surgeries, my shoulder works for the most part, and I can't help but believe that the doctor royally screwed me. Story 43. I'm someone with autism whose mother thought vaccines would make it worse. So my life was at risk, and she somehow thought that was okay because I could have been like the kid around the corner who didn't speak, apparently. I tried to get all the vaccines when I turned 16 and again when I went into uni at 18, and I was ill for weeks, which messed up some important exams for me. I also broke my finger when I was little, and it's still out of place to this day because she said there was nothing wrong with it. Broke my wrist doing gymnastics, and she let me cry and not sleep for a week with how much pain I was in. Couldn't have pain meds because that was bad for kids too. And then was so annoyed at me that she called my dad, separated, to take me to the hospital because she couldn't deal with me anymore. Had to have a cast on for several months, and she just laughed when we got home. Same woman also hit me so badly when she lost me in a park that my grandparents took me to the hospital and she refused to go with them because,
What were they going to do?
and,
They'll only blame the parent and make things up.
okay, respectfully, Opie's mom, they probably wouldn't make things up because it sounds like, well, you did hit OP, so that's not looking great for you already. All the rest of this is just crap icing on the garbage cake that you've served OP. I would say great work, but you don't even deserve my sarcasm. Story 44. Not my doctor, but a doctor my mom was seeing. My mom was experiencing numbness on the entire right side of her body for a couple of weeks, and when I came into town, I urged her to go see a doctor. She kept brushing it off and would get really upset if I mentioned it. Note, I live out of state now, so she was probably the last person I saw that trip before I drove back home. A couple of weeks later, she finally went to a doctor and they said it was carpal tunnel. Yeah, I'm no doctor. That doesn't sound like carpal tunnel to me. The next day, she suffers a massive stroke. Was in the hospital and ICU for a couple of weeks, but we didn't know if she was going to make it. She survived, but suffers from several deficits as a result, including not being able to walk. Literally, if they had diagnosed her properly, they could have told her to go to the hospital, which was on the same block, and they probably could have stented the artery that caused the stroke. Needless to say, we have an ongoing malpractice suit against the doctor. Story 45. Not so much I know better than my doctor, as I know better than your doctor. In January, my younger brother, 22, was diagnosed with 2 acute leukemias, which, as you might imagine, is very rare and very dangerous. He has been told several times now that without chemotherapy, he will die. The amount of people that have recommended various dietary supplements is mind-boggling, particularly for turmeric. While I understand that most of the time these opinions are well-meaning, there is one person that takes the cake on this. There is a friend of his that lectured him on how chemo only makes a difference against cancer 1% at a time, and how he is essentially poisoning his body. They also told him to try a healthier diet and exercise more when he was bedbound in the hospital for several months after his diagnosis. The last thing they said to him was that if he gets sick at all during his chemo, it's his own fault for going through with it. Until this point, it didn't even occur to me that people might be unsupportive of his cancer battle. He is currently on a course of aggressive chemotherapy and full-body irradiation before his bone marrow transplant in a week's time. Story 46. My mom is really bad. She's an anti-vaxxer and she's also slightly mentally ill. I'm so lucky I grew up with both my parents, even divorced, because my dad was sane. My mom has had a lifelong paranoia of doctors stemming from her childhood, and when they caught wind of the theory that vaccines cause autism, she started blaming every health issue ever on them, justifying her own paranoia. Her poor dog, my childhood dog, got a nasty tumor last year. She had a lady she worked with who was a vet biopsy IT, but refused treatment when it came back as cancerous. The dog is still alive and seems to be doing fine almost 6 months later, so I guess it might be okay, because she doesn't seem to be in pain anymore, but the poor pup hasn't gone to a vet in the 11 years we've had her. I'm surprised she's still okay. I could go on. There's so much to unpack with my mom, but I'm pretty scared that one day someone will find her dead because she has some untreated illness. I love her, and I don't want to lose her because of this. Story 47. Ex-girlfriend told me the story of her friend's boyfriend. These people are in a polyamorous relationship, and this woman's boyfriend apparently contracted chlamydia. Went to the doctor, they prescribed antibiotics. But being into the alternative lifestyles and solutions, he did his own research via the school of Google. Read about how live bacteria cultures in yogurt out-reproduce and replace the less symbiotic gut bacteria in the stomach, and realizes he's found the one true path. He proceeds to dip his dong in yogurt to make the burning stop. Well, it did not, in fact, make the burning stop. I met the woman in this saga once, and after one encounter, Totally believe she would date someone like that, but never had the pleasure of meeting the Jonas Salk of the Yoplait School of Medicine. Story 48. My boss is a doctor and we do a lot of occupational health stuff. Pre-employment physicals / reviews, return to work exams, reviewing employee fitness for duty, that kind of thing. The two most common things I see are people with severe sleep apnea who refuse to use an APAP or CPAP and insist that they're fine, and people with untreated diabetes who insist that they don't need to diet and exercise and that they're fine. Both groups end up dead, often. The diabetics end up dead, but with 1 or 2 less feet from the untreated diabetes. People just refuse to admit that they have major problems, and they insist we're there just to screw them out of their job. We literally had one guy suing us and his employer because we pulled him from a safety-sensitive job due to an untreated condition. He insisted he was fine, got his local doctor to say he was safe to work, sued, raised a stink, and then died from said condition within a month. Story 49. My mom was a nurse for a mental hospital in her prime. She adopted me when she was almost 60. Once I hit about 12 or 13, a lot of the hospital started going way downhill. She hated going to any hospital beside her GP. So of course she hated taking me too.
I'm not putting my child through the trauma I've gone through. This hospital will do jack for us.
So her response was feeding me her meds when I got sick or had a pain because
I can do better than those jerks at MCG.
I'm sure she meant well somewhere in there, but it really bit both of us in the butt for a hard and long time. Addiction is already a pretty hardcore trait in my family genes, and she knew that, and I didn't. But it didn't take me long to figure out. Story 50. Wife's cousin had to take preeclampsia medicine because she's in crap shape, pregnant, and pre-diabetic. She obviously didn't take the medicine because she didn't believe the doctor. Baby was born at 28 weeks, like 1 to 2 pounds maybe, and they both almost died. Listen to your OBGYN, people. Oh, and she's a staunch Republican on welfare, so American taxpayers paid for all of her bad decisions. Story 51. I sliced my finger open pretty badly, blood everywhere. It hurt. Mom said to put a Band-Aid on it. Eventually, after a few days, we take the Band-Aid off and the skin around the cut was completely black. When Dad saw it, he said, "Oh, we should probably have taken you to get stitches," followed by him and Mom laughing it off while I peel the layer of black, dead skin off my finger, stare at the lumpy scar, and come to the realization that if I think something's wrong, I shouldn't take it to them. Story 52. More simple denial than I know better, but my mom always had trouble making her patients admit they were alcoholics.
You need to cut down on alcohol. Your liver is dying.
But I don't drink. I'm not an alcoholic.
Okay, how many drinks did you have yesterday?
Well, my friend came, so we shared a few, socially.
How many?
12 or so.
And?
Well, a glass of wine at lunch, obviously, but it's good for the heart, isn't it?
Carry on.
I went to the bar in the afternoon, so obviously had a few beers with everyone.
A few?
8 or so. Then I had one more at dinner and I took a nightcap before going to bed.
Sir, you are an alcoholic.
But alcoholism is when you drink alone. I'm just being social. Oh yes, sir. Sorry about that. Let me tell your liver that you were just drinking with friends and to remove all the alcohol from your system. I'm sure that'll go over well. Story 53. Roommate's 40-year-old aunt was a nurse who was diagnosed with breast cancer about 8 years ago. She had started chemo when her boyfriend threatened to leave her because she wasn't bearing him any children. She went off the chemo and gave him 3 children, after which she didn't go back to the chemo. 2 months ago, she made an emergency trip to our country for medical care as the cancer had spread to her lungs and they were filling with fluid. She passed on shortly after as she was preparing to go back home. The boyfriend never showed up once, nor did he call to check in. Just a messed up situation. Story 54. My dad, optician, had a patient who was developing cataracts. Normal for someone of his age, perhaps a bit early. He'd recently been flashed by a speed camera and insisted that the bright light had caused the cataracts. My dad gently tried to explain that it wasn't the cause, and that while UV exposure can cause cataracts, it's an accumulated lifetime risk, which is mostly caused by exposure to the sun without eye protection. Still, this guy insisted he'd be able to sue the council or government. They were chatting a bit more, and it came out that before this guy had retired, he was some kind of inspector for nuclear power stations. He had a story about how they swapped radiation bags with one another so they could inspect more facilities. The bags measure radiation exposure, and are checked to make sure you don't exceed something called the maximum permitted exposure. He was swapping bags so he could exceed this, apparently, by quite a lot. Anyway, Ionization radiation can cause cataracts, among with a number of other things as you can imagine. But this guy was still certain it was the speed camera which gave him cataracts, clearly the most obvious answer. Story 55. My mother. She's severely disabled but refuses to listen to me or her doctor or concede to being disabled. She had a bad fall down the stairs a while back that broke her, pretty much everything. Broke her shoulder, hip, 3 ribs, a vertebra, forget which exactly, and cracked her head open with bleeding in her brain. Thankfully, she's still semi-functional after all that, as in she can walk to the bathroom by herself, but she seems hell-bent to drive herself into an early grave as soon as possible. She can hardly walk, can't stand for any length of time, is legally blind because of the head injury, and still continues trying to do all the things mothers do: cooking, cleaning, taking out trash, etc. I constantly have to babysit her because she's too damn stubborn to admit she's disabled. She's given herself several new fractures since the initial fall from doing stuff she's not supposed to. Broke her foot, gave herself a compression fracture in her spine, and recently broke a rib walking into a door, just to name a few. Despite all this, she vehemently insists that she is, quote, fine. She also has osteoporosis, and it took a ton of arguing from both me and her doctor to get her to take meds for it, because she's also very anti-medication. She finally broke when her doctor's patience snapped, and she said something to the effect of, "Listen, lady, your freaking bones are melting." To give you an idea of the sort of person my mother is, she once walked herself to the hospital after falling and breaking her tailbone. I don't even understand how that's possible. Story 56. I had a patient with neck pain and radicular pain going down into his arm. I've seen patients with similar issues before. We tried a few conservative treatments of decompression and I saw no change. I try to send him to a neurologist and he refuses to go. His daughter wanted him to try her essential oils instead. After his issues continue to get worse, he reluctantly lets me send him out for an MRI. A tumor on his lung pressing against his brachial plexus. They remove a portion of his lung and save his life. I say, wow, it's great that we got you out for the MRI. He responds that he wishes we just let him die. Story 57. So I was in 7th grade. I had just recovered from 3.5 weeks of pneumonia and felt a super sharp pain in my right ear. I knew something was wrong and complained to my mom, who was actually a doctor. As my mom had work, she had my dad take me to the pediatrician the next day. Went to the pediatrician, who checked my ear and said, nothing's wrong. Dad agreed and said I was probably just exaggerating. I insisted there was a sharp pain and something was wrong. I kept complaining of the pain, so my mom decided to check my ear. I had an ear infection and my eardrum was bulging with pus behind it. My mom immediately made my dad get me the drops and stuff to help with my ear. She was mad at the doctor who did nothing. That night, my eardrum tore or something. It's fine now, but it was super painful at the time. Story 58. Not exactly an I know better moment, but it kind of applies. So my doctor is an orthopedic surgeon in Texas, and he deals with a lot of backwoods, absurdly obese people pretty much daily. And one day, this extremely large, around 350 pound woman came into the OR with a completely shattered foot. I mean, that sucker was turned into powder. Apparently, she flipped an off-road side-by-side and got her foot crushed under it. My dad absolutely hates operating on ankles and feet. He likes hips and knees, so he was dreading the surgery. It took about 30 to 45 minutes to do whatever doctors do, perform miracles, I guess, and he believes he's done with it for now. The patient gets released sometime later and then immediately decides to get back on the side-by-side and hey, I bet you can guess what happens next. She rolls it again and crushes the same ankle, which screws up the screws and rods in her leg, keeping everything in place. She then shows back up and gets operated on and gets her now meat-ground ankle all patched up again. So a few days later, my father receives a legal notice with a ton of paperwork citing what he's being sued for. So he defends himself in court and gets sent to the Texas Medical Board, knowing full well he's done nothing wrong, and this Einstein is the one who screwed it up. But the case gets closed and he was found negligible by 2 or 5% or something, I don't know the rules. All because she was booked back into the hospital within a certain amount of time. So he got a strike on his license, and now has to go to the medical board every 6 months to prove he is capable of being a doctor, all because of one idiot. Story 59. I'm a nurse. I won't go too far into detail because of laws and stuff, but I did have a case where I had a patient who had sleep apnea. For those who don't know, sleep apnea causes a potentially deadly heart arrhythmia called atrial fibrillation, where one part of the heart flutters 4 or 6 times faster than the rest of the heart. During this, a blood clot can form, break off, and said blood clot can travel to places where it shouldn't be. That results in stroke, heart attack, or pulmonary embolism. One of the treatments of sleep apnea is to lose weight. Another is to use a CPAP machine to assist in breathing at night. And for those not in the know on sleep apnea, it's where you stop breathing in your sleep for sometimes several minutes, your oxygen drops, and you can cause heart and brain damage. Anyway, patient loses like 100+ pounds at the urging of his doctor after he has started on a CPAP to help with the sleep apnea. Suddenly, he's not feeling well. Ends up in the ER with a full-blown widowmaker heart attack. I'm talking to him and finding out about his health history and hear about his weight loss. He said, "I lost so much weight I even stopped using my CPAP." Well, I then asked if his doctor told him this. His reply? "Nope, I just figured I didn't need it anymore because I'm at a normal weight." He still had sleep apnea, still had atrial fibrillation, and then almost died because he never bothered to ask his doctor for a follow-up sleep study to see if he needed the treatment anymore or not. Lesson here? Always follow up, especially if you suddenly think you're healthy. Story 60. Does it count if it worked out? A few years ago, I started getting strange stomach pains and anxiety attacks after I ate. Was having nightmares every night. It was scary. It was like my body was intolerant to everything I ate. I was losing so much weight. I went to the ER, spoke to doctors and specialists, had CT scans, colonoscopy, was told I was stressed out. I was coming down with the cold, IBS, given medication, antidepressants, but I never trusted their diagnosis. I felt like they gave up on me. Anyway, I started researching a lot and self-diagnosing because I was scared it was something worse. I lost so much weight I was afraid I had cancer. Anyway, I came to the conclusion that I had SIBO. Went to a gastroenterologist and told them to test me. Test came back positive. They gave me antibiotics and I was cured in a week. All this running around in misdiagnosis for 9 months to be cured in a week. But hey, I'm glad I never gave up. This thread has been a roller coaster. Lots of cases of ignorant patients and lots of cases of ignorant doctors. I will personally always be a fan of second opinions, or even third or fourth if you really feel like something is wrong. Sometimes it takes multiple pairs of eyes to look at something to find out what's actually wrong with it. In this case, I guess it is you. Anyway, yes, if you are unsure, get a second or even third or fourth opinion. That being said, taking it all on yourself and taking turmeric, apparently, wouldn't recommend personally. That being said, I feel like, I don't think I have to cover myself legally, but I am not a doctor. If I accidentally gave medical advice during this, don't take it. I don't know what I'm talking about. I'm just a dude who reads Reddit stories. That being said, I hope you liked the Reddit stories that I read today. I also hope you have a wonderful day or night wherever you are, and I will see you in the next one.